ADHD, this window of capacity is really quite narrow, and it's so easy for children to become either completely overwhelmed, overstimulated, or underwhelmed. I mean, I'm actually talking about babies even here.
Dr. Becky Quicke
is a clinical psychologist with over 2 decades of experience in assessing girls for ADHD and autism.
She's a committed advocate for neuroverse children and adults
with a specialized interest in modernizing the assessment for AuDHD women.
Toddler tantrums versus meltdowns and overwhelm, they really are different. Our aim at Autistic Girls is to help families, their child is AuDHD, to understand that, what that means, so that they can kind of work it out together, rather than child kind of developing ways of trying to shut that down, not feel it, mask. When a child comes to understand themselves, and actually even just giving the diagnosis, it can actually change things really significantly.
Loyal listeners and viewers, I can't thank you enough for tuning in. If you've ever felt broken or different, I hope this helps in your search for answers and community. And do you know what would really help me in return? By clicking the follow or subscribe button wherever you're listening. It might not seem like much, but at ADHD Chatter, it means a huge deal. And with this, I can book more incredible guests and keep the self-discovery fire alive for all of us, myself included. Just one click of a button goes really far. And remember, you have always been enough. Dr. Becky, what an honour to have you in the studio. Thank you so much for joining us.
Oh, thank you for having me.
What is it about the dual diagnosis, AuDHD, that someone like yourself who's worked so closely with it still doesn't make sense to you?
I think in my professional life, so as a clinical psychologist assessing people, and I hope this doesn't sound arrogant, but I don't ever feel like, oh, that doesn't make sense. Like that's my thing that actually it does always make sense. So we do a screening call with people, and they'll start to describe their experiences, and I'm always thinking, oh yeah, that makes sense. So yeah, I get that. Yeah, that makes sense. So there isn't anything, I think, when I'm working professionally, but personally, there are often times where, because I'm obviously in a different mode in my personal life, and sometimes I kind of think, so my partner is autistic, and it's only recently that we're kind of like, oh, actually, you're also inattentive ADHD. It's not hyperactive impulsive, but it's inattentive. So until we made that realization, and now that's really helpful, but until then, a lot of stuff didn't make sense, because he likes things to be really kind of quite exact and quite precise, and then he would make a lots of careless errors, and my brain would be like, what's going on? So yeah, I guess, but that's how it is, isn't it, in our personal lives? Like in my professional life as a clinical psychologist, I'm focused, I'm thinking, I'm making sense, helping people to make sense of things, I'm trying to understand, and so it kind of does make sense. But then yeah, in my personal life, I sometimes might it might be different.
Is there anything that you might see in an assessment? Like someone comes to you, you're going through the assessment for, say, autism or ADHD, and they'll say that they do a particular thing, and that rings AuDHD bells to you?
Yeah, so that will quite often come up obviously in the screening assessments. So there's a few things that ring bells, but not necessarily about the actual diagnostic criteria. Let me explain. So they might say, they might say something that like, I kind of, I do like to have things predictable. I really have that preference, predictability and routines, but then actually sometimes I really don't. And so I don't understand, like, which is it? So that happens. That's a very, very common one. Or sometimes I really love, going out and social, being with people. Then sometimes actually I can't see anybody for a long period of time. So, those kind of things come up, and I'm like, oh, okay, what's kind of going on here?
Very much like that internal conflict, like a tug of war, one pulling them in a different direction.
Yeah.
Through your career, has the diagnostic criteria process changed for autism and ADHD?
in the past, well, I've got a few things that I think that have changed quite a lot. In the past, first of all, with adults, people who had autism diagnoses were seen within learning disability services. So I've worked in learning disability services, and that's where people would be referred to. But a lot of those people with autism didn't have a cognitive learning disability at all. So, and I don't think that's happening. I think that's shifted, that's changed. And I think that this quite a big shift, and I think this is sort of building, is that a lot of diagnostic assessments in the past have been based primarily on observation. So observing how somebody behaves rather than actually getting to understand their internal experience. So I do think in the past sort of few years, we're starting to, thank goodness, starting to understand that actually how someone behaves doesn't necessarily indicate how they're experiencing the world. And so I think there's been a real shift from kind of observational assessments, and it just makes me feel really uncomfortable, the thought of just observing someone. Yeah, it doesn't sit with me, but also I just don't think it's that helpful. So moving towards more collaborative discussions where we are, and this is absolutely our ethos at Autistic Girls and Autistic Women, where we're trying to understand somebody's internal experiences, because there's lots of reasons why people might not express that and not feel comfortable in certain situations to express how they're experiencing the world. It might not come out sort of in external behaviour, as it were.
That internal experience that you're describing, what could that feel like for a child? And how could a parent look out for presentations of that feeling?
So AuDHD, there is a very narrow kind of window of capacity. Actually, it used to be called, well, it's often referred to the window of tolerance, but I put that on LinkedIn recently, and someone really helpfully shared that they describe it as the window of capacity. So this window of capacity is really quite narrow, and it's so easy for children to become either completely overwhelmed, overstimulated, or underwhelmed. I mean, I'm actually talking about babies even here, or underwhelmed, so not having enough stimulation. So it might be that you notice that your baby absolutely loves the toys. You get these, even when the babies and they're lying on their backs, and these toys with these flashing lights, and it's all, amazing. And the baby might be absolutely engaging with that and thinking that's amazing, kicking their legs, but then actually having significant difficulties regulating. And as a parent, the baby is crying and crying and crying. And so it's kind of, even at that early age, and I've experienced that myself as a parent, that's why I can kind of talk about that it's really, really tricky to get that balance of giving enough stimulation, but not overstimulating. So kind of fast forward into kind of toddlerhood and preschool and into school, that's definitely a really, really tricky area, I think, for parents. Yeah, and I guess as a child experiencing that, that's really, really difficult, wanting that stimulation, getting excited about things, but then feeling completely overwhelmed and then dysregulated. And often that can come out in behaviour. They can angry and outbursts. It's a really, really difficult thing for children and parents to kind of manage. And that's a really key AuDHD thing, I think.
At that super young age that you're describing, the child might be contending with this internal tug of war, but they don't have the verbal skills yet to articulate that. How might that frustration show before they have the ability to verbalise those feelings?
Definitely with babies, it's distress, it's crying. It's distress, and for parents, it's tricky to help to regulate a baby that becomes that overstimulated. So it's about kind of managing that and letting there to be a little bit of stimulation, but actually making sure that's not very much, and creating an environment where then you drop the stimulation so that the body doesn't become totally dysregulated. Because an autistic and AuDHD body, and ADHD to a certain extent as well, is a very permeable in terms of sensory. The sensory stimulation just kind of comes in from the outside world. And like I say, the body's very permeable and it feels it really intensely. And so obviously until a baby child is able to develop their own ways of regulating, then they become, very dysregulated. And then it can be expressed similarly, toddler. I think this is really interesting thing about toddler tantrums versus meltdowns and overwhelm. And they are different. They really are different. I think it's really, I guess it's tricky for parents to know. And a lot of parents feel like, oh, this is, toddler tantrums, it's a terrible twos and things like that. But actually, what parents have described to me is it's different. It's really quite extreme. And it's really, really distressing for some parents. And obviously for the child themselves to be feeling such extreme kind of overwhelm.
Is it possible for the two conditions, the ADHD and the autism, to mask each other? Like they almost cancel each other out, and therefore you get missed, you don't get picked up, you don't get diagnosed until you're an adult?
Yeah, that definitely happens a lot. Yeah, they can kind of, that happens. We get women who come in for a screening call and an assessment, and absolutely that's been their experiences. They kind of, I'm not one and I'm not the other, and but actually quite often they're both. But there is quite a lot of talk of them kind of almost cancelling each other out and it not being shown. But also I think it's really important to say that they intensify each other as well. So I always think that like ADHD almost like can really intensify the autistic experience, and it can be, it can really kind of almost put a rocket underneath things. And intensify the emotional experiences, and it can make it very, very difficult. Or they can work beautifully together. Some people have said that it works really well, and actually it's meant that they're able, they are able to develop strategies to organise themselves, but actually it doesn't come. It's not easy or intuitive to be organised, and actually the attention does get pulled, and it's hard to regulate the attention. But actually, they really want to have that sense of kind of feeling organised and things being predictable. And so, some people talk about them working beautifully together, and I think that's really important to talk about. It can be experienced. There can be difficulties, but actually, we do get some women who come through and have an assessment, and they're not experiencing a lot of distress because they've created a life that really works for them, and actually they've kind of worked the two together. Someone like that historically would not receive a diagnosis, even though we can see, we've done the assessment, we can see actually having that collaborative assessment with them, that's how their brain works, that's how they experience the world, and actually they do reach criteria for autism and ADHD.
I suppose it must be quite hard if you've got these sort of predisposed stereotypes of what ADHD and autism are or is to be those two. Because you might think, well, my opinion of ADHD is like the naughty boy, very energetic, very chaotic, impulsive, disorganized. If you're also ordered and organized, but you are impulsive sometimes, you might think, well, I don't relate to the stereotypical view that I have of ADHD, or I don't relate to the stereotypical view that I have of autism, therefore I can't be both. And that must just compound this feeling of confusion and not belonging.
Yes.
It comes up so many times on this podcast, this feeling of being broken and feeling misunderstood. And I suppose it all comes back to years and years and years of not understanding why and not having that context and reason for your behaviours that to you just seemed such in contrast to what you've been taught is normal. So I suppose how important is it for someone to get diagnosed with AuDHD as early as possible? And what are the sort of consequential effects on the developing brain of someone who is made to feel broken and confused or misunderstood in their early years?
What comes to mind for me as the kind of overwhelming thing is shame. With shame being, I am wrong, rather than, guilt is, I have done something wrong. Shame is, I am wrong. Because there are so many, like you say, messages from people, from school, from family members. And so, yeah, it has a massive impact. I've worked with a lot of children and obviously adults who were children who've experienced that. And the shame is very, very toxic when a child comes to understand themselves. And actually, even just giving the diagnosis, it can actually change things really significantly. We've had parents say that we haven't had any meltdowns after that diagnosis. Doesn't mean that, I'm not saying like you get a diagnosis and everything's absolutely perfect, but to know that there's a reason and you can understand and explain these experiences, there's nothing wrong. You're not wrong. You are absolutely right. Because that's the message we give to these girls. There's absolutely nothing wrong with them. It just almost, the shame dissipates and kind of goes, really subsides. And that obviously is a hugely positive thing. So if that doesn't happen and the shame continues, then you start to get towards people understandably not being able to tolerate those high levels of shame. And so having to develop what we'd call psychological defenses, so defense mechanisms to not feel that shame, either massive doing things to avoid those feelings or projecting those feelings into other people. Projection is a defense mechanism, but doing things as they grow older, into teenage years, adolescence, young adulthood, to not feel that shame. And that's when that becomes potentially problematic.
If you have ADHD, one thing that comes with it is the famous ADHD intuition. And my ADHD intuition tells me that you're all begging for that sought-after, sponsored ad read. Well, wait no longer. Here it is. Tiimo app is a perfectly tailored app designed specifically to help improve your organization. It's something I'm fast becoming dependent on to help get me through the day. If I want to remain organized and productive, that is. Organizing a podcast, writing books, taking meetings, running errands, and looking after my cactus is so much to manage, you can end up getting overwhelmed and forgetting things. That is, if it weren't for Tiimo app. And this is how. Tiimo is designed specifically to hack the neurodivergent way of thinking. We have a brain that might struggle with time agnosia, object permanence, memory cognitive load, task initiation anxiety, or procrastination. All things I also fall victim to. Oh, perfect. It's reminded me it is cactus watering time. The award-winning Tiimo app is the perfect life-hacking tool to help your time management and kick you up the bum when you need it most. If you want to stay ahead of the competition, then the visual planning Tiimo app is specifically designed to help your structuring, organizing, focusing, and goal setting. It has a visual timer providing a tangible and visual representation of time to help users pace themselves so you never miss a deadline ever again. It also has an efficient lock screen reminder service to alert those of you who are very out of sight, out of mind with your chores and afraid you might forget them. It brilliantly centers all of your tasks in one place to streamline your overflowing schedules and make them much more digestible and a lot less intimidating. And for those who find big tasks too overwhelming to even start, Tiimo breaks them down into more manageable subtasks to get the ball rolling. Right, now I need to go and change my trousers. Back to the episode. It's so interesting. I guess there's quite a lot of knock-on effects of living a life that's not in line with who you really are underneath, or not understanding why you feel different. I mean, if you feel different, right, you're probably going to put in so much effort into trying to be quote-unquote normal, masking, and therefore you're going to be hanging out with people that might not be good for you. Or you're going to be getting into relationships that might not be a good fit, or starting a hobby that isn't aligned with who you really are because you don't know who you are. And if you're doing that, you're going to quit the hobby, you're going to leave that job, you're going to end that relationship. And all of this cycle of sort of starting and stopping things, abandoning stuff, it's just going to perpetuate that inner critic that says that you don't belong, or you're broken or useless. These horrible things that the community purport to think about themselves. I think, and as soon as the earliest you can recognize that you are who you are, you're not broken, that you're just different, you can peel back that mask and stop a lot of that damage from happening.
Yeah, and there's I mean, I've talked about shame there and the kind of emotional development, but there's lots of other ways actually that an early diagnosis can be extremely helpful. So without it, and like you say, living in a life that's not aligned with who you really are, you can't really understand your needs, and therefore, create a life and be in relationships that align with your needs. And we know that, especially with girls, there's a lot of social vulnerability with autistic girls in particular. But I think that and it's a complex thing. There are lots of reasons why that is. But without that awareness, you can't then know what you need. So situations that are probably going to be difficult, and what to do about that, and talk to, as a younger child, talk to parents or talk to friends about that, or with yourself kind of work out actually what do you need. Without that awareness, you're kind of behaving in a way to, like I said before, to kind of avoid those difficult feelings of feeling different and feeling shame. And so your behaviour is fueled by fear, really, and anxiety, like you say, to kind of fit in and do those things, rather than being fueled by what works well for me, what feels good. So then you don't learn to know what does it feel like to feel good, what feels nice, what feels easeful, what works for me. And so quite often if women, come to us later on and have a later diagnosis, it's really is like saying, peeling back those layers, and working out. I mean, a lot of women will say, I don't know what I need. And, so there's a real process there. I mean, the diagnosis is often a first step. And then it's kind of peeling back that layers, whether it's with themselves and kind of that exploration and that discovery of themselves and community and being connected with other people who are similar, or whether they have support through a therapist or a coach. We feel really passionate about helping girls and assessing girls to understand themselves. That's where it all began. We actually started out just assessing girls. That's what our service was. And then women got in touch saying, oh, I love that you have a focus just on girls. How about women? Are you assessing women? And we were like, okay, well, yeah, let's develop that. And that's just blossomed. So we assess both now, because there's that, kind of working back and helping women to kind of work things out from where they're at, but also really trying to kind of help girls early on.
You said something a moment ago that really made me think. You said you avoid uncomfortable feelings. And I think so many people in the community spend too long doing that. Like, you're so terrified of getting triggered by a rejection or a criticism or not being perfect. And that means that you don't know how to put boundaries in place. You say yes to everything. You people please. You put everyone else's needs ahead of yours because you're so fearful of somebody looking at you as less than perfect, because you intrinsically feel that you're not. Therefore, you put so much effort into appearing so. And the thought of someone seeing through that camouflage is so terrifying that you don't know how to say no to things. You don't know how to. You can get into vulnerable situations, particularly as a woman, I imagine.
Yeah, that's really nice summary, actually, of a really important issue around when people struggle and are kind of coping developing ways to cope rather than actually. I talk quite a lot about how understanding ourselves means that we can create a life where we don't need to cope.
It's such a brilliant moment. I remember when I got my diagnosis, age 34, lots of emotion. You must have been in front of lots of women when you've told them, I imagine in some cases, finally, after so many years, that they are AuDHD and the emotional reactions that you might see in those moments. Do any stand out?
Yeah, and the women and girls and parents. It really varies. So for some people, the word that comes to mind is relief, and that is predominantly what we experience, I think, for girls and women. Although I'm just thinking, there's a piece of research with people who have had a diagnosis, and they talked about feeling relief, so grief and relief. So there is the relief, but then there's the grief. I'm talking about women here. Actually, parents can experience that as well, even with young girls, actually, because there's been a period of time of not understanding. But yeah, absolutely the relief. What's coming to my mind actually is some of the girls are, and this is just, I just think it's amazing, and it's really quite exciting that they, I remember one parent saying, because they told their daughter that we diagnosed autism and ADHD, and they said that she squealed with joy. And I was just, and we get that. So sometimes it's actual real excitement. This is who I am, and it just makes sense. And just that, if you think of the impact of that, on the trajectory of that child. But it's not all like that. It's so with some families, there can be such a mix of emotions. There can be guilt, that I've not known this, and if I'd have known this, I might have done these things differently. It really varies. But actually, a really significant thing that I've noticed, I don't know what the percentage is. Actually, I'm kind of done the numbers, but quite a significant percentage of girls after our assessments have then, or their parents have then, taken them out of mainstream education, which some people might think, well, that's not a good outcome. But actually, the assessment and a diagnosis has made them realise that their daughter is burnt out in quite a serious way. Quite often, that's common, and that mainstream education at that moment in time is just really not working. So whether it's homeschool or online schooling, and this is not easy, this is really not easy. So that, is a difficult process. However, for those girls, I guess the families are kind of coming together and going, okay, this isn't working. We need to look at something that will work. So I have noticed that it's literally been within weeks.
Yeah, gosh, school can be a trauma factory, can't it, for neurodivergent children?
Yeah, and I think it's that realisation that actually this is too traumatic for this girl right now.
Does justice sensitivity come into this conversation in terms of you get a diagnosis for the people who are slightly later and say they're in 30s, 40s, 50s, 60s, 70 years old, and they get this diagnosis, can they get really angry at the fact that they haven't been picked up sooner?
Yeah, that can happen as well, definitely. And we have assessed women in their 70s and all the way through. Yeah, absolutely. That's definitely, I hear that a lot, actually. Real anger at it could be people, situations, establishments, real frustration and anger. I've noticed with the women we've assessed that I think there's a phase, and it's only a small number of weeks, it's not a long time, but there's a short phase where I think actually I would recommend no recommendations. So we do make recommendations on reports, but I think there's a phase of kind of just letting it sort of settle and just kind of almost everything settling and becoming reordered a little bit, really, and then working out from there, okay, actually, this is what I need to, potentially need support with, or actually for some people, we're all good. Actually, that's just kind of the piece, the missing jigsaw piece that I needed. And but I think that those first few weeks, it is a real cauldron, a real melting pot of emotions, and it's kind of letting that settle a little bit and then working out where to go from there.
I mean, the injustice of it all is massive, isn't it? Do you think that there is a contributing factor behind why so many women have been missed for so long?
There's a number of things, I guess, that impact how women, and we've been talking about masking, but kind of present themselves. And I think a significant factor is about social conditioning. But I think it really impacts, it definitely really impacts boys and men as well. But the gender sort of stereotypes, which happen so early on. I mean, it's blown my mind as a parent to see other parents who I really like and respect, as even with babies and young children, talking about, that sort of typical boy, he's always moving, he's always running around, and she's a girl, she's sat, drawing. I wish my boy would do that. And so girls from a really young age, I'll just focus on girls because that's my personal experience and obviously professional experience, learn that's apparently not okay. And there are obviously girls, well, just girls generally, we don't have to even talk about ADHD, but very, very active girls, but you kind of learn that you're not meant to do that. And so, definitely the kind of social conditioning of girls being good and be honest, like obedient, doing what you're told, all that kind of good girl programming has a massive impact. And actually, so a lot of girls kind of become, very, very good girls and sort of switch everything off or kind of learn how to not show their true selves.
I can just imagine, the sort of young girl, say, who might feel that need to move, want to move, desire to be more active, but stop fidgeting, sit still. And so they keep it inside, and that hyperactivity quite quickly works its way to their head, to the thinking, to the brain. That those highly caffeinated squirrels come back, and the anxiety comes. And then you get misdiagnosed with an anxiety disorder when you're 15, 16, because you were told that moving is wrong and impolite, and that's not how young girls should behave.
And also with AuDHD, moving, it's just, I'm just thinking about how the education system requires children to just sit still, and it's just bizarre. But so moving and being potentially told off because you're ADHD is the worst thing for an autistic child who doesn't want that attention, doesn't want that doesn't want the teacher pulling attention to them, people looking at them. Like, it's that combination of so really, really make sure you kind of develop strategies to not move, sort of fidget slightly, but like you say, all kind of internally, kind of keep yourself stimulated, keep your brain stimulated.
Speaking of trauma factories at school, like, I think
trauma factories, that's funny.
It was from so many people I've spoken to on this podcast. It was really hell, right? School, you, for those reasons we've just mentioned and many others, just feeling different. And how does trauma interlink with AuDHD? And is a child that is AuDHD more susceptible to experiencing trauma?
It's a huge topic. I feel like we could have a whole podcast just on that, to be honest. It's a complex one because I guess it depends on the family environment. And I do think that there are some intergenerational kind of patterns around not being diagnosed. So hypothetically, parents who are neurodivergent and not diagnosed and struggling, creating an environment where potentially they struggle to regulate their emotions, and so could be shouting, could be aggressive, or could shut down. Other way, could shut down and kind of withdraw, and so that then impacts the child and their relationship with their parent, because that's the kind of that we're social mammals and we learn about ourselves, about others, and about the world from our caregivers. We're not born; we're born as very vulnerable beings, and we learn it all through those caregivers. And so, if there's an environment where there's undiagnosed neurodivergence, that can then have an impact on the child. So they could experience trauma in that way. I've worked with lots of families prior to these assessment services. I've worked with a lot of families like that. And then it depends, I guess, whether the child then learns to understand themselves, or if not, stays in that environment. And then, we were talking before about the feeling of shame and sort of doing things to not feel those feelings. So there can be trauma in the family environment. But also, we were talking before, weren't we, about social vulnerability and experiencing having different experiences that potentially put someone in a situation where they might experience trauma. So yeah, it's a really, really complex topic. And in assessment, it's quite important to unpick all of that. And I mean, really kind of focus in and take the time to unpick that, rather than just saying, oh, actually, you've experienced trauma, even development. So early years trauma is called developmental trauma. So in those first early years, you've experienced that early developmental trauma, or you've experienced trauma through your life. So actually, how you're experiencing the world can be explained by that. So we won't diagnose you. That, it's just really not okay, I think, to not take the time and unpick it, because there are differences. So in terms of in terms of social relationships, if someone's experienced trauma, then there's likely to be kind of mistrust within that relationship. It's different from somebody who's autistic and struggling with relationships, and that's more around social cues and kind of there's differences. Now, somebody obviously can have been experienced trauma and being autistic, and so both can be there. But it is about unpicking it. And actually, there are some really helpful tools for clinicians. One of them is called the Coventry Grid, which actually, and this has been developed for children. Really need something for adults, but around when something indicates trauma and when something's autism, and it goes through in detail all the different things, and it's different. So it's important to kind of work out, what it might be, or both, really.
Well, so in terms of like experiences that could look like a child is presenting as AuDHD compared to how a child might be presenting in a response to a trauma, are those two presentations similar?
Yeah, it can on the surface look similar. I think that's what's tricky. So I've worked with a lot of children who've experienced trauma. That's kind of been my majority of my career to date. And I'm going to be completely honest. I look back to, 10, 15 years ago, and I think, oh gosh, there are some that I now with my work now, I look back and think, gosh, I actually wonder whether, that child might have been neurodivergent. And there is research to show now that in terms of children who are in foster care, looked after children, there's a high percentage of neurodivergent children. And those are the services I used to work in, and really don't think that we were aware of that in the past. So, and I know that that's kind of changing. What's quite telling is in the interactions, actually. So it does feel very different when you're with somebody who has experienced a lot of relational trauma. So they might be more wanting to kind of have control over you and kind of dominate and have control over you, and that kind of gives them that sense of control. Whereas someone who's autistic or AuDHD, it's not about being in control over another person. They're not mistrusting and anxious within that relationship, which understandably happens when someone's experienced relational trauma. It's more about actually the environment and having things kind of predictable and kind of having that preference for the sameness and the control in that way. So it does feel different as an assessing clinician. So there are sometimes we have not diagnosed because it's been really clear that there's relational trauma. And as a girl, what we often say is if the girl hasn't reached diagnostic criteria, they may do. It's not sort of saying, well, that's it. They're not autistic or ADHD or AuDHD, but we sometimes can't diagnose in those situations and say, let's see how things go and come back. We don't have to have a full assessment again. We can kind of review because potentially it might be there.
How important is it to have, I suppose, like a healthy family dynamic if you are an AuDHD child? I suppose what would your definition be of a healthy family dynamic, and why is it so important?
I think probably the most important word is trust. Developing that trust. It's where, like I said before, children learn about themselves, about other people, and about the world within those key caregiver relationships. I'm using a very kind of not medical term, but that goes kind of, because it could be mother, father, it could be anybody really, but the caregiver. So developing that model of who they are, and how they are with other people and the world through those relationships. And so it's where we, as children, develop. Hopefully, this is where it's a really healthy. This is what I would say is a healthy family dynamic, I guess. Is that security, that secure base, it's called in psychological terms, of a place to feel that you can kind of go to, where you trust and like I say, feel safe. And so the body can kind of, relax and be taken care of. And that's just, it's essential for that's every child. That's a healthy family dynamic, and it changes over time because obviously how that dynamic is as a young child shifts, because as you get into adolescence, it's actually you've got a phase of where there is the kind of relationships are still really important about developing a sense of self, but actually starting to shift towards the child, the adolescent, doing that themselves and in interactions with their peers and more kind of outward facing, and then coming back into the family unit. It's kind of both really. But yeah, it's obviously a healthy family dynamic is important for absolutely everybody. And I think that with children who are AuDHD, where things are tricky out in the world, even if things are not tricky at home and actually really nice and healthy and relaxed and secure and safe and trusting and all that kind of stuff, the world can be really difficult. And so I guess what I would see as being really healthy is working that out together, and parents kind of being able to support them to, if there's changes that are going to be made, thinking ahead. I mean, it's a lot of pressure on parents, but yeah, being aware of things that are going to change and letting them know and say, this might be difficult, what could you do? And kind of problem solving together, really.
It's really interesting because you would hope as a child, if you are AuDHD and you're struggling at school, masking, super exhausted, and you kind of look forward to going home because that's your safe space. That's where you're going to get respite from that anxiety, that need to mask because it's your safe environment. But there must be situations where, say, you have an AuDHD child and the concept of thinking differently and it just isn't accepted in the family. Maybe even the parents are undiagnosed ADHD or AuDHD, but they just have an unwillingness to confront that. That lack of openness and willingness to confront and accept neurodiversity, how could that impact the healthy family balance?
It's really, really tricky, and it's great that you raised that actually, because children are a mirror for us as parents. It's like a mirror, and you can kind of, and that can kind of go one or two ways, really. It can kind of be like, oh, actually, you kind of start to understand yourself through being a parent, or actually it can be a mirror and it can kind of shine a light on a part of yourself that you don't want to have shone. And so that defense potentially for some people is pretty strong, is pretty solid. And that can be really damaging, because if there's a parent who doesn't want to kind of understand that themselves in that way and thinks there's a kind of, like I say, there's defense against it, then obviously not only are they going to struggle to then acknowledge and understand their child, but also there's then this kind of learning that there's something wrong. We're going back to that shame again, really, aren't we? That actually there's something wrong if my parent doesn't want to, is struggling. Then with that, then there must be something wrong with it. And if I'm experiencing that, then there's something wrong with me too. So yeah, it is tricky. But I mean, a lot of families on the flip side, it's either quite often that they're understanding their child and they're going for an assessment with the child, and they're like, oh, light bulbs are going off. We have that with parents all the time, and that's brilliant, I think. And I think that does happen a lot, and I think that's really super nice for that to happen.
Yeah, gosh, no, it's so interesting. I think I've heard it so many times on this podcast. An adult, a late diagnosed woman, has eventually been diagnosed because their child got diagnosed, and that child kind of said, look, mummy, you're the same as me. And there was reluctance at first. I think the parent or the mum kind of can feel bad because they have this unhelpful, inaccurate stereotype of what these things mean, and therefore they start going, oh my God, what have I done to cause that? This unhelpful narrative. And then they go on that journey together. And it's, it's a really nice thing to see.
Yeah, it is. It's very powerful. Yeah.
This has been so insightful, Dr. Becky. I want to reveal your ADHD item, which is underneath that cloth. I ask all my guests to bring in an item that most represents ADHD, or maybe this is AuDHD actually today, but we'll find out. Oh,
this is AuDHD.
This is AuDHD, yeah. Fantastic. Your AuDHD item is some tomatoes. Yes. I'm going to hand those to you.
Oh, right.
And yeah, be careful they don't explode. Why does tomatoes represent AuDHD? I'm fascinated.
Yeah. So tomatoes, the fruit that doesn't belong in a fruit salad.
Controversial, but I like it.
And so you see tomatoes, they don't belong in there. Fruit that don't belong in fruit salad, but also they're often hanging out with the vegetables. But they're not accepted. They're not accepted there either. They're not a vegetable. So they don't belong anywhere. And that is such a common thing that women say to us at the very, very beginning of their journey. And I think that's been a reason for the late one reason for the late diagnosis, because it's like I don't fit with, the kind of autistic community, and I don't fit with the ADHD community. I don't belong anywhere. And that's been and actually that's because AuDHD is I think it's a third. It's a thing of its own, really. And so yeah, like the tomatoes, a lot of women we assess don't belong in the fruit salad or in the bolognese.
So many are like painting themselves green and pretending to be an apple.
Yes. Oh, we could. Yeah.
Or yellow. You're not a melon. You're a tomato.
Yes, absolutely. Yeah.
This has been so insightful, Dr. Becky.
Oh, thank you for having me.